Welcome to Be Empowered, the podcast. This is a podcast where we dive into the realities of healthcare and entrepreneurship. We offer our opinion, unfiltered, unapologetic, and always with a dose of empowerment. We are here to amplify voices, yours and ours, challenge the status quo, and explore what it truly means to thrive. So let's get into it. I'm Dr. Santoshi Bilakota.
Dr. Shalom Mota.
And today we're going to talk about why doctors are now employees. Back in the day, doctors were not employees, and that's kind of what prompted us to do this episode. Every time I look online or I have a conversation with another physician, we always talk about how back in the day, right, in like the 80s, the 90s, the early 2000s even, a lot of doctors owned their practices, but now a lot more doctors are employed by hospital systems. So why did that happen? And I think that change in and of itself has really contributed to the burnout of physicians, the lack of autonomy of physicians. We're treated like we are not valuable, quite frankly. And I think, especially over the last 2 decades, all of these factors have created a quiet but seismic shift in the landscape of healthcare. In 2012, just over 60% of physicians owned their practice. But as of 2022, 74% of physicians are employed by either hospitals, health systems, corporate entities like private equity backed systems, insurance companies, pharmacy chains. So that's a huge flip. We went from about 60% of us or even more owning our own practice to now the majority of us are employed. And that is from the Physician Advocacy Institute. That's their data. There are alternative models of practicing medicine popping up where you don't have to be an employee to a hospital system. And you can explore other options. So, Shala, do you know anyone who owns their own private practice or works outside of the hospital system? Other than you and me, we're independent contractors.
Right. Yeah, I do. I do know a few friends that own their practice. And it's interesting because in 2005, I wanted to gain more medical experience to put it on my resume. And I was working for this physician as an MA. So he had just opened up his own private practice adjacent to the hospital, but it was not owned by the hospital. It was his own private practice, and he had a partner in that practice who was a surgeon. He was an internal medicine doctor. He would come in the mornings, and he would just go to the adjacent hospital around on his patients, and in the afternoon would come to the practice and see his patients outpatient in his practice. So I thought that was the model, right? I thought that all physicians are like that. And I grew up in Iran. So a lot of physicians practice like that. Basically, they have their own practice. They can see, 10 patients, or they can see 50 patients. Whatever that they like to do, they can do. And that was what I envisioned. But shortly after I finished medical school and residency, I couldn't see that anymore. Everybody who I talked to, they were like, yeah, we are hospitalists, for example, or our practice is owned by the hospital or owned by private equity, and we have to contribute to this much overhead. And things drastically changed, even as an undergrad, to the time that I graduated. So that was the drastic change that I saw.
I think this shift has changed a lot in terms of like the doctor-patient relationship too. Physicians have less autonomy because we have people above us a lot of the time, like multiple layers of administrators telling us what to do and what not to do and how we can practice. There's also a lot of push for productivity quotas. That was not the case when we were employing ourselves. And with those things combined, it leaves less time for meaningful care. And I think that shift has not only like worsened burnout, I think it also accelerates burnout, right? Because you have these new grads that go into these models and they sometimes are in very unfair contracts and are drowning.
Right. It's because the autonomy is taken away. There's less autonomy and less negotiating power. I think that's why they start struggling. a lot of people, when the hospitals or private equities can hire a lot of people, then you lose the negotiating power, right?
And also, I think insurance companies are getting worse. There's a lot more requirements for billing properly. There's a lot more like systems in place that are leading to increasing administrative burden for us. And I think when there's increasing administrative burden, there's this need to hire more and more administrators. And now there's more administrators than doctors, which is kind of crazy to me. Um, there's also this EHR and increasing documentation requirements. So someone has to regulate how we're documenting. Like now you have coders looking at our data. There's like billing units of the hospital that like look at your documentation to see if you're documenting properly and if you're billing properly. So that's another layer of administrators who are managing all this. Malpractice risk and overhead is also going up by a lot, which I think discourages physicians from opening up their own practices because a lot of us have a lot of student loan debt when we come out, and starting a practice isn't cheap. So you take all of this into account. So, your malpractice insurance is going to be high, your overhead is going to be high. On top of that, you're going to have to hire people to make sure you're coding and billing correctly. I think that is very daunting, and it's much easier to just go work for somebody than take the chance to figure all of those things out on your own.
Exactly. I mean, imagine, a new graduate having, $400,000 debt, student loan debt, and then what do you need to open a private practice in the beginning? You need loans, right? So, I mean, who is able to just convince themselves that I'm going to get more loan, on top of the student loans that I have, more loans to open a private practice? I mean, it's very it's scary, right? It's scary for people.
It's scary. And I think one of the big things that people always kind of quote when they talk about physicians losing ownership is the Affordable Care Act, which did many things, some of them good. But in 2010, it restricted the expansion of physician owned hospitals and it prohibited the creation of new ones. The primary goal was to limit the growth of physician owned hospitals, and the reason for that is they didn't want physicians to like cherry pick and be biased against who they'll admit, and also run their own operations because they thought there was going to be a conflict of interest, basically, if the physician was the treating provider and also running the show. But for some reason, we can't do it, but private equity can.
Yeah, it doesn't make sense, right? And we can talk about basically who owns hospitals in the states. Okay, so we have hospitals that are non-for-profit hospitals that are owned by charitable organizations, religious groups, or they're community-based entities. And there are other hospitals that are for profit. And these are the hospitals that are owned by private investors, by corporations and shareholders. Although they do pay taxes, federal and state taxes, but they prioritize services that offer higher financial returns. Okay, so but again, so the financial returns should not be to the doctors, but should be, it's okay that the financial returns are for private investors. And then there are other types of hospitals that are government-owned hospitals. So these are local state hospitals and run by either federal governments or state entities. So these are kind of community public hospitals. Like, for example, the VA hospital is a government-owned hospital. Approximately 57% of community hospitals are non-for-profit, and about 24% are for-profit.
Who are they profiting? Like the stakeholders,
The
like you said? I mean, they're
stakeholders.
definitely not profiting the healthcare workers who are working there. But
Yeah.
yeah, they're profiting stakeholders. And so I don't understand why that is a better option than having a physician own the hospital. It's ridiculous. I really think. And I think that's why many physicians feel trapped, they feel burnt out, they feel disconnected. And there's a lot of moral injury. Like they're like, this is not why I went into medicine. And unfortunately, the current models in place have made that feeling more prevalent amongst healthcare workers, I think, especially physicians.
I mean, a lot of these hospitals are also getting larger and larger. They're corporate chains,
Yeah.
which is very sad. And when you have that, it's it becomes, I mean, very difficult for physicians to thrive and have their own, independence, right?
I also like insurance companies also hire physicians quite a bit. I mean, I often see job postings by like Optum or United Healthcare where they're running or they own the clinic and they're hiring doctors for it. It like blows my mind. How are
Definitely.
they allowed to do that?
Yeah, definitely. Yeah, I've seen that too. Telehealth nowadays, some of the telehealth platforms are owned by or corporations. I mean, it's mind blowing to me.
Yeah, these people are so greedy. And, healthcare is a business for sure. Healthcare is a business. I'm not arguing with that. But the business seems to keep becoming more and more unsustainable, where the costs keep going up for the patient. And the profits are also increasing for the people that are benefiting from it. But, we're all aware of the statistics that show that in comparison to inflation, in comparison to healthcare expenditures, doctor salaries have remained stagnant. I think in relation to what we used to see back in the day, I almost feel like the salaries have gotten less.
Oh, it is. It is less for sure. I mean, or stagnant, I would say, because of these private equities and bigger hospital chains kind of owning a lot and having to make the decisions on behalf of the physicians and the patients.
Let's talk about some alternative models that we can consider, because even though the majority of physicians are employed by systems, we don't necessarily have to be. There are other ways to do this. And one of the ways, we'll do a separate episode on this, but Shala and I are independent contractors. We do primarily per diem. We do our own contract. So that is something that we can cover in a different episode where we talk about the pros and cons of W-2 employment versus 1099 employment. But for this episode, we'll talk about some of the more popular alternatives that other doctors are considering. So one is the direct primary care model, and slash concierge medicine, if you want to call it. A lot of the primary care doctors are doing this. I think some specialists are doing this as well, where the patients pay a monthly fee directly to the doctor. There's no insurance middleman. The doctor can decide how much time they want to spend with the patient, 30 minutes, 60 minutes. I've even heard of like 90-minute first time visits, which like unheard of. I don't even know what I would talk to a primary care doctor for 90 minutes about. But it's great for patients with chronic conditions, for complex. It also allows for better continuity, less paperwork for the doctor. So they're not drowning in administrative burden, but they can instead have smaller panels, get paid adequately, and spend more time with the patient.
And we will talk about this model with a few colleagues that pursued this model and are very happy.
According to the DPC Alliance, there's about 1,600 plus practices in the US. And I think this is going to be a powerful movement because these guys are just bypassing insurance. And I think if we could show insurance companies that they're not necessary, it might actually fuel some more changes. But I think, unfortunately, that's probably going to take a little while longer. Another common alternative that people are doing are their own independent practices. Also, maybe micro practices, which is independent practice on a smaller scale. This usually is a solo group, or like a very small group with a very low overhead. They use AI, they can use virtual assistants to help streamline care. And that way they keep their low overhead low. Some of these groups are just doing telemedicine, telehealth. Like I've seen the integrative doctors do this, the obesity medicine doctors do this. There's some holistic doctors that are doing nutrition counseling do this. You could do it all via telehealth. That way you're keeping your costs low. You can choose your own hours, choose your own focus areas and practice style. And you can do this on the side while you're employed, as long as your contract does not bar you from doing that. I forgot psychiatry also does this. Like, I know a
Right.
couple of psychiatrists who do their own independent telehealth practices while also being employed, which is kind of nice because once you're making enough money there, you can just go just do this.
Right, exactly. Again, it might be scary at first, but we'll talk about methods on how to do this. Everything is scary at first, but once you do it, then you realize the difference, right? And I think we have to kind of educate our new grads about this stuff. Like I see myself when I was a new grad, I didn't explore anything really. Just kind of the first thing in front of me, I took it and I was happy for some time. But I think the new grads, this is very important for the new grads to see these models exist. And there are other models. So, for example, like physician-owned groups, like co-ops or physician-owned groups. So this is like a collaborative model where physicians have shared ownership and decision-making ability. There are some bigger organizations that kind of say that they are physician-led, physician-owned. Make sure that it is really truly physician led and physician owned, and physicians are decision maker. I think there is a little bit of a distinction between the two, that even some physician led, physician owned, the regular physicians may not have decision making powers.
Yeah. So there are, like you said, there are a few physician owned private practices still out there, or like collaborative models where a bunch of physicians maybe independently practice, but it's under one umbrella. Um, talk to the people that already work there. It'll give you an idea of how fair that workplace is, because a lot of people, I think, will say we're physician owned. Um, and they might be physician owned, but the reality is there's sometimes often a hierarchy where you might have to buy in for like a partnership per se. I know a lot of private practices do this, but there's a buy-in. Like, you usually have to pay a lot of money up front, or you have to commit a lot of time up front. So just be careful. A lot of the times, the physician-owned groups do want some kind of commitment, and if you are not 100% sure that's where you want to be, you also don't want to be stuck.
A smaller physician-owned group, or if you and your friends build up a practice, I mean, you can really build it up how you want it. So I think there's a difference between just the private physician-owned that you are building up versus joining a group that is larger and you'll be one of many.
Exactly. And then there's also hybrid models. We've talked about this before, and we also have an episode on non-clinical work, but there are people that do both clinical and non-clinical work and do part-time in both, which is what you and I do. And I think for me, that's been the best balance, because it also helps me use other parts of my brain that aren't just medical based, right? And part-time work can mean different things for a lot of people. They can do some consulting, you can do career coaching, you can do medical writing. I've also seen physicians be like Pilates instructors or yoga teachers, which is completely different. But I mean, I'm kind of jealous. I wish I could do that too. But so there's options. You don't have to only do clinical work. You can mix it up. It doesn't always have to be medical. It diversifies your income at the very least and protects you against burnout, and helps you regain your identity. Because offline we talked about how a lot of us associate ourselves with our job. It's like, oh, what do you do? I'm a doctor at blah blah blah, or I'm a doctor. I mean, a doctor is your job. That should not be your identity.
And just diversifying income protects against burnout. It definitely does.
Because you don't feel stuck. And I think that's the
Right.
big thing. I think what makes burnout worse is when you feel like you're working for somebody and you have no control over what you're doing. So there's a few common fears, and I had this as well when I left full time work. And the common fears are like always the same thing. I'm not business minded. That keeps coming up. I sometimes say this as well. So a lot of physicians are very good at sticking with what they know and what they've been taught. And so deviating from that can be scary, especially if you have a lot of loans and you go, well, I'm a doctor, I'm not business minded. But that's not fair. Doctors for the majority of our timeline have been business minded. They have been business owners. Furthermore, we've spent so much time in school, like we're intelligent people, you know. I don't think we should not be able to overcome that barrier of I'm not business minded. Okay, so teach yourself. There's books, there's like YouTube videos, there's a lot of ways, or talk to people who've done it. But you have to really overcome that mindset of I'm not business minded.
I think they want us to feel that way. These big hospital systems, they want us to feel that we can't run a practice on our own.
You're absolutely right with them saying, oh, they want you to feel that way. They kind of want you to feel stuck. And it's interesting you say that. This reminds me of when I first started my academic job, and we had our little HR meeting or whatever, where the practice manager talks to us about all these things. And she told us, she's like, don't worry about billing. You don't have to worry about billing. You just see patients. We'll take care of it for you. And, at that point, it was like, oh, okay, how nice. I just get to see patients. But now that I'm like 7, 8 years down the line, I'm like, why don't they want us to know how to bill and code? So much of our reality, like 90% of how we earn our money is through billing, right? But were we ever taught that in school? No, they don't want to teach you that.
I remember when I was working at that private practice, it was before the era of EHR, or it was just kind of starting. So we had this billing sheet, okay, and there are like multiple diagnoses on it, and you just kind of circle what diagnosis the patient is there for, and then you send it to a billing kind of department to take care of it. But yeah, you don't know what happens beyond that. Through my other job, I had the experience to see. I mean, yeah, there is a lot that goes on in the billing world, but it's not hard to learn. I mean, it's not hard to learn.
And I think other barriers that people feel are, okay, W-2 jobs give you some benefits. Whereas if you're working for yourself, you might not have those benefits like health insurance, 401ks. And I will cover this in a different episode, but I work as a 1099 person. I provide my own health insurance. It's actually not that bad. I pick a plan that works best for me instead of having to sign up for a plan that's offered to me by an employer. The deductible is high, sure, but it also has a really good HSA. It covers certain things that are important for me. I don't necessarily think choosing your own benefits is the worst thing. Plus, if you have a spouse who's W-2, you can always hop onto their insurance. I don't necessarily find that to be a big barrier. And of course, stability, because I have had people who have offered me W-2 jobs say this, you're an independent contractor, that's not stable. You should also have a W-2 and also do 1099. But the reality is, I think 1099 jobs can also be stable. It really just depends on how you structure them, but how strong your contracts are. Like right now, I'm working multiple different contracts. And even if I lose one, I think I'll still be okay. So I still have stability and some paycheck coming in. However, I think if you are someone with a family and you're like the breadwinner of the family, I can see how that can get a little tricky. You want to make sure you're relying on that steady paycheck coming in, which unfortunately can be variable if you don't have a full-time W-2 job.
Yeah, but is there even a stability with the W-2 paycheck? That's
No, they can fire you anytime.
Exactly. That's what I'm saying, because there are people who get laid off even from W-2 jobs, and I'm hearing even physicians. If you don't follow a certain if you don't fit a certain box that they want, they're just gonna start annoying you and frustrate you, and patients complain, and patients or administrators complain, and then all of a sudden you don't have a job, or they make it so miserable for you and it's so intolerable for you that you have to leave. So then what do? If you are a 1099 and you have multiple contracts, you lose one, it doesn't affect you as much. But if you have a W-2 job, that's all of your income. And if something like that happens, then you don't have any stability, any income stability.
Yeah, definitely. W-2 also does not have stability. You're absolutely right. And then lastly, I think people think if you leave a traditional work environment that you'll make less money because again, you've not been making a lot of money or any money through school, and then training, you're making such minimal money that when you get your first W-2 contract, you're like, oh my God, I'm going to be making so much money. And then for you to venture off on your own, that is scary because you're like, oh, now I'm leaving the stability, this big paycheck. Maybe I'll make less money. And sure, that's always a possibility. But I mean, look at the doctors that are doing DPC and concierge medicine. They'll tell you that they're not making less money. They are able to see less patients and actually make more money because they can set their rates. As an independent contractor, I set my own rates. I'll tell you, I'm making more money than I was with my W-2 job. Does it take a little bit of time for you to get to that point and build it up? Sure. But in the end, you're working for yourself. And I think that makes it satisfying.
I agree, definitely. You're incentivized, to do what's best for your patients and for your family.
You're way less burnt out because you have options. Again, I think a lot of that burnout comes from feeling stuck, like we've said so many times. So if you can make yourself unstuck, I think there's a lot of freedom in that. Um, so what do you need to get started? We'll put some of these in the captions, but there are places that will offer mentorship or coaching. There's DPC Alliance, some docs, Seek, which does a lot of IME work and non-clinical work. Consult with a CPA or a business lawyer if you're going to set up an LLC, if you're going to incorporate as an S corp to do your taxes. And again, we'll do another episode on this, but Shala and I are not lawyers or accountants by any means, so definitely consult with someone whose job it is to make this financially possible for you. And then just talk to someone, talk to people, network, talk to physician entrepreneurs. I think if you're going to stay within your academic circles or your W-2 circles or even our own conferences, sometimes it's really hard to branch out and see people who are stepping outside of the box.
Yeah, exactly. This is all part of a system that medicine feels broken, but it's really not us, not you. It's a system, So this is part of rebuilding a system.
Exactly. It shows that you can still practice medicine with integrity. That's the big thing, right? You don't have to sell your soul. But you can also have some of your autonomy back, some of the joy. When was the last time we had joy at I'm laughing because you can't cry, but it really does infuse a little bit more autonomy and joy into the job. Your job should be fun. You just have to step off the pre-lined path and think outside of the box. Have like a clear vision of what you want to do and what kind of care you want to give. And then you can build around it. But I can't emphasize this enough. You have to network, you have to talk to people who have done it. And you're smart enough. You're definitely smart enough. Physicians can be business people, and we are business people. And you can create a life or a job that fits around your life instead of the other way around.
Well, thanks for tuning in to Be Empowered, the podcast. If you enjoyed this conversation, don't forget to subscribe, leave a review, and rate this podcast. Share it with someone who needs to hear this. Stay strong, stay empowered, and we'll see you next time.
Thank you.
Thank you.